Okay. Hello, Raj.
Hi, Ryan. How are you doing?
Doing well, thank you. We have some questions that come up a lot when we're in our working in physical therapy, and whether patients have whatever diagnosis, they all seem to ask the question about managing arthritis, like knee pain.
Yeah,
And
very frequent.
yeah, I've
The
had some
population that we see, elderly people, especially bone on
suggestions out
bone.
there. So you have some suggestions out there that you've addressed with that we could share and talk about?
Um, sure, most commonly the patients complain of knee pain, swelling, and bone on bone. These are the terms that I hear frequently. And I first thing I ask them is, what's your pain rating? Like a 0 to 10, how bad is your knee hurting? So do you want to explain pain scale, so that the viewers can understand how to assess their pain from 0 to 10?
Yeah, what I mentioned is, 0 is just no pain at all, and then a 10 is just most excruciating. And a lot of people say, "Oh, it's a 10 out of 10." And I said, "Okay, well, I better call 911. That means we need to get to
Exactly.
the hospital."
A
Oh,
lot
no,
of
no, no,
people
no,
say
it's not
10.
that bad. So, a lot of times arthritic pain can generally range between, 2 to maybe a 5. It's there, it's noticeable, and it's just enough to really limit their functional activities.
Exactly. Yeah. And I think, arthritic pain can be 7 or above, but it's more severe when there's severe damage in the knee, bone on bone, especially when the doctor says your knee joint is bone on bone. That's when people, complain of about 10 out of 10 pain. And that's true. It's a subjective scale, so whatever a patient says, that we have to accept it. But we can
Mhm.
explain them, right? So that's what I do. I tell my patient, if it is 10 out of 10, as you said, I have to call 911. You have to be in the hospital if it is 10 out of 10.
Mhm.
So how to treat the pain that is below 7? It's not severe pain, but patient is their function is limited because their knee is hurting. What do you suggest?
Yeah, I think when they have the pain level, and my priority is looking at how bad it's affecting their functions in that. And so I suggest there's a few things that are pretty common is, the heat or ice are the two things that come to mind. And there's also a third option that's a TENS unit that's really
Great,
helpful.
yeah.
And
And TENS units are very cheap nowadays. On
yeah,
Amazon,
yeah,
I'm seeing like $17, $18.
yes.
There's a TENS unit. So Amazon, I will include some affiliate links in the description below.
Yeah, yeah, and some of them just take like a 9-volt battery or a couple AA batteries, and so they really don't cost much to keep them going, running too. So they're really a nice thing. I've had a lot of people really like them.
Um, I recommend my patients use ice pack. Most people don't like ice, but I really highly recommend them use ice pack because of it's a general, a natural anesthetic, as well as another thing is it decreases inflammation and prevents
Mhm.
edema, swelling. So for those reasons, I highly recommend. Heat is also, you can use heat, but in very minor pain and no, especially when patient is not feeling any warmth on the knee. If the knee feels warm, that means there is some inflammation. So in those situations, I highly recommend ice pack and TENS unit. That's what I usually suggest.
Yeah, and that's what I've been told too. Is a lot of if you question whether it's heat or ice, what should I use? It's kind of generally about 80-90% of the time you should do ice. And that,
That's
yeah, and sometimes it's not as comfortable in that. But like what Raj just said, feel the warmth. If the knee is really warm, there's some already swelling and inflammation starting, and heat will just encourage more swelling and inflammation. So the heat is actually trying to draw the blood, which is a good thing, but sometimes too much of it is not good.
Exactly.
Hopefully ice can
And
help with
and
that.
some people use contrast therapy where they use ice,
Yeah.
a few minutes and heat for a few minutes. That's also okay, but it depends on what the situation is.
Hmm.
If there is swelling, I would definitely stay away from heat.
Right.
Um, and how long to use? That's another question most people ask. And how
Yeah.
frequent? What do you
Yeah,
say?
and I mentioned that to the sometimes it matters how much layer you have on. I mean, if you have a lot of layer,
Exactly.
you don't need that ice
Perfect.
on for a long time, but then you don't want it to get frostbite either. So typically, I think like a pillowcase, if you have something just enough to where it's cold. Yeah,
Perfect.
that's
Yeah.
the purpose. And
That's exactly what
maybe
I tell
about
my
10,
patients.
15 minutes is sometimes a general rule with them on there.
Yep.
And mhm.
I agree.
But that's at
Totally.
one time, yeah, but then
Right.
depending on the swelling, you might have it on 3 or 4 times a day.
Or even more because there's no side effect, right? I tell my patients use every 2 hours.
Mhm.
There's no side effects. Like if you take a Tylenol, ibuprofen, um, if you are taking regularly, it may have some side effects like it can cause some peptic ulcers or some people don't feel good when they take pills, chemicals. So our goal as a physical therapist, we want people to use natural, treatment
Right,
modalities,
right.
ice, heat, and electrical, which is TENS unit, is also okay because it doesn't have any side effects based on research. I mean, I don't think there is any research on or any studies on um, side effects of TENS. So
Yeah,
it is pretty safe to use. Most people, I use ice and TENS very commonly. If I have any joint pain, I use ice and TENS. Those are my go-to for pain
mhm,
management.
mhm. Good. Yeah, with medications, we've already got enough in our systems as it is anyway, so it's nice to go through a natural approach and then but blood flow is important too, so sometimes I'm cautious on having it on all the time, but just having it off and on so that in those
Exactly.
moments your body's getting blood flow
That's
to them
why I
to help the
recommend it
healing.
about
Yeah,
2 hours every
yeah.
every 2 hours. Perfect. And I think that's it for this video. We are going to make many more videos on different topics. So please stay tuned. Thank you.